So, if you wanted to start by giving an introduction of yourself, that would be nice.
Very good question. I wasn't prepared for that, but yes. I'm Yerko Berrocal. I'm the Assistant Dean for Foundational Sciences. In this role, I'm in charge, or I'm actually overseeing all the foundational sciences and making sure and ensuring that they're all covered throughout all the 4 years of our curriculum. I'm a physician by training, but a medical educator for the last 12 to 15 years. Before joining the new medical school, I work at the University of Illinois, the College of Medicine. And before that, I worked at Florida International University, also the College of Medicine.
Okay, so how did you get involved in medicine first?
All right, let me think about it. That's all right, you ready?
Yes.
So medicine has been always a childhood dream for me. I think that medicine, in a way, correlates pretty well with my personality. I've always felt that I care too much for others, and sometimes I care for others more than I care about myself. Another thing that really made me choose medicine is since little, I've always had I was very passionate about science. So science to me was so important that I found in medicine a way to kind of put these two components together and integrate it. So I've been always involved in little science fair and things like that when I was little. And I thought that medicine kind of provided me that mix that I really needed in my career. Another thing that I do care about is, that I've always thought about is I'm a people person. So I always found that medicine kind of provided me a mix to help people, right? To learn on a daily basis, right? Being challenged, because every case, everything that happens in medicine evolves and changes. And also to learn as a person, right? To evolve as a person in this environment. So medicine, just for all those different things that I just mentioned, provides you that unique opportunity. I can give you a personal example for that and how medicine kind of helped me translate my training then into other aspects of science, right? So right after I got my medical degree, I practiced for a year, but then I've always had a passion for science. I mentioned that to you. So having a friend that was paralyzed on a wheelchair kind of triggered me something that I was not expecting. So I decided at that point in my life to spend 7 years of my life doing a spinal cord injury research to find a cure for paralysis. I was semi-successful, let me put it that way. We went into clinical trials and they're still testing the cellular therapies. But yeah, we'll see what happens in that regards. But after that, and being in the lab and being a former TA in my medical school, I found that medical education, I was always a passion on me. So there was an opportunity in new medical school, and I was I immediately fell in love with medical education. So that so medicine is offered you different opportunities, right? To help others, to get involved in science. And now I never thought that I was going to be involved in medical education. So yeah, that I think is why I got into medicine.
That's really interesting. So if someone wanted to attend medical school, what type of advice would you give them?
Several. I think that medicine, or just being a medical student, is such a privilege. I think a lot of students in your place right now, they have this dream, and not everyone can actually get into medical school. So yeah, to me, medicine is kind of the ultimate career. This is a place where you have the privilege to care for others. You care for people. Yes, you have them as patients, but you really care for people, for their families, And those things have an impact in your life and your family. So if you don't, I think, if students cannot take that responsibility, if the students cannot see that, or they're not responsible enough to take care of their patients as a person, I think that there are so many other careers to choose from. Another thing that I guess it is really important to think, nowadays, unfortunately, I've seen that a lot of students choose this profession because they're looking into making money. This is a profession that you really, let me put it this way, right? You're gonna go into so many years of medical education, residency training, then let's say, for example, a fellowship. You're gonna invest so much time in this career that if you're just not too happy and you were just going for the money, I think that this is something that I guess I wouldn't recommend, because it's something that you're gonna be involved on a daily basis for the rest of your life. So if this doesn't make you happy, I think that you should pursue other careers that will make you happy.
So what is something you wish you knew before you went to medical school?
Oh my God, this is an excellent question, because in one of my previous lives, I was involved in counseling students. So this is something that for future medical students, I think that there are a few things that you might want to work on before enrolling into medical school. I think one of the most important things is organizational skills. That's how I survive. Having a good schedule, I think it's critical. I was able to do so many things just because I had a schedule. I was able to manage a restaurant, I was able to have a family just because I had very good organizational skills. So organizational skills, having a good schedule, working on those things early or before you become a medical student are critical. Also, another thing that I highly recommend, when you go into medical school, I highly recommend to not compare yourself to others. Everyone is in their own journey. It's not healthy to compare yourself to others, because at the end of the day, everyone, all your classmates, it's a select group of students, probably like the 1% of the nation. So this is it could get very competitive if you start comparing yourself with others. So I highly recommend to stay away from that. Another thing that I believe that it's really important is to prioritize your personal time. Yes, medical school is extremely busy, you're working almost 24/7, but at the same, you have to make sure you give yourself breaks. You make sure that, I don't know, you take a day off to spend with your family, with your friends, or as I mentioned before, right, organizational skills are so important that you should always insert on your schedule some personal time to, I don't know, just exercise, to go to the gym or hiking, right? So those are pretty important things that I guess you should consider. Another thing, I guess, another very important aspect of that, in addition to what I mentioned, I think there are scores, right, that you're gonna get. I think one important thing to remember is that there are grades associated that will be associated with your performance in medical school, but at the end of the day, a grade is not gonna dictate how successful you're gonna be in medicine. And I think that that's just a few points. I can probably talk a lot more about it, but I think that those are good initial steps that you should consider.
Yeah, I like that a lot, because people get really caught up in the toxic pre-med culture where you're always trying to outcompete people, so I think that's a really good point. So moving on to more of the school itself. So Alice Walton the school talks about the holistic med school program. So what does that actually mean?
So that means that we're gonna see people as a person Like we're gonna have this whole person approach. And it not only will be applied to our patients, it will be actually applied to the students. We wanna make sure that we follow holistic principles. We make sure that emotionally, right, socially, right, mentally, we tackle all these different things so that you succeed as a student. We're thinking, we're thinking that in addition to that, we're gonna make sure that our staff also is involved in whole health principles. So faculty, everyone is involved. We wanna make sure that our students are agents of transformation. So I think that this school will provide a unique environment to pursue that specific characteristic in our future professionals.
That's really interesting. So what would like a student schedule look like at the basic level, like entry into med school?
All right, so this is a good question because this is, as I was mentioning before, this is evolving as we talk. Right now we have hired faculty and we're having these conversations where we're designing the curriculum. So for now, what I can share with you guys is that we're gonna start our week with a patient narrative or family narrative, right? Right after that, we're gonna have sessions that are gonna be delivered with active learning pedagogies, right? Where we're gonna incorporate all the different components of our curriculum, right? We're gonna provide all the foundational knowledge. This is where anatomy will be introduced, physiology, pharmacology, just to mention a few disciplines, right? And later during the week, we're gonna integrate this to the foundational sciences, to whole health principles, to health system sciences, to interprofessional education, and kind of like wrap up the case at the end of the week. So that's how we think that's how we're picturing right now our schedule. But yes, it is, integration is part of our framework for classes. Active learning, we're gonna prioritize that. We're gonna use evidence-based approaches to promote higher order thinking in our students. So that's where we're emphasizing a lot, integration with all the different components of our curriculum.
That's really interesting. Will that continue through all the 4 years, or?
It's exactly, so that's kind of like an important thing about our school. Traditionally, let's say for example, the foundational sciences, they're covered in years 1 and 2. What we want to make sure is that we talked about integration, that we integrate all those concepts throughout the 4 years. So let's say for example, when our students are rotating, they're doing their clerkship rotations and they're working on internal medicine, that we go back and cover mechanism of actions of different drugs, the pathophysiology of diseases. So we're gonna be very prescriptive in how we design our curriculum so that everything that it's all the different elements of our curriculum are covered throughout the 4 years.
That's really interesting. So with class structure, like what would be the class size and faculty and student ratio?
So right now, all our planning, our preliminary conversations is to have 48 students. That's what we're designing our classrooms and everything. And in terms of faculty, we're gonna have a faculty ratio of 3 to 1.
That's good. I like that. So you get like a more personal connection with everyone.
That's right, and I think that's something really important that we're looking into our school environment.
Okay, so along that, how are you planning to address like student mental health issues? Because burnout and exhaustion is just a big problem that medicine faces right now.
So we're gonna tackle, absolutely, that's a very good question. I think we're gonna tackle those issues from different angles, right? One thing that we wanna make sure, and you mentioned weekly schedule, we wanna make sure that our students, we're gonna allot in their schedule 3 half days for them to work independently on their learning, right? To do the things that they need to do on their daily lives. Besides that, we're kind of like staying away from lectures. So we're gonna, I guess the workload associated with in the classroom setting will be minimized by having these conversations. We're gonna put all our students in a small group setting, active learning environment, so that collaboration starts from the very beginning. In addition to that, we're gonna require all our students to have an advisor during the 4 years of their curriculum, and everyone, not only the students, faculty will be associated with an advisor throughout their career to kind of like also make it as, I guess, to remove that stigma that if you have a counselor, everyone will have one, right? So it's going to be very unique, and I think it will provide a unique opportunity for the students to come to work in a stress-free environment.
That's really interesting. That's one of the things that interested me the most about the med school when I was first researching it. So that's really great. And then what about like research opportunities? Because research is obviously one of the biggest fields in medicine, and it's like so interdisciplinary.
Yeah,
Do you have-
absolutely. So research, I'm not sure if you've been able to see a description of our curriculum. It's called the ARCHES curriculum.
Mhm.
So the R of ARCHES, that relates to research, entrepreneurship, and innovation. So our students are going to have the opportunity since day one to do an innovation project, a research project. Where they're going to have different opportunities to come up with different ideas. Let's say, for example, to find something in the literature, we're going to have a small clinic in our school. So if they want to do research in the things that they see in our clinic, or if they want to pursue something that they really are interested in, we're going to provide mentorship throughout all that process. But at the end of the day, our students will have plenty of opportunities during the 4 years to come up with their own research projects, so that we create a path for them to succeed in the future.
Okay, that's really interesting. Thank you.
Do you want to go through what ARCHES stands for?
Yeah.
Sure. I have my cheat code here.
Okay.
No, I know everything, but there are so many details that I might forget. All right, so our ARCHES curriculum, right? So the A stands for Art of Healing. This is something unique. I don't think that any other medical school actually have incorporated in their curriculum. This is a great opportunity for us to incorporate the humanities, right? This is something where we're going to incorporate like therapeutic presence. We're going to talk about professionalism. So this is something very unique for our medical school. We talked about the R for research, innovation, and entrepreneurship. Yes, our students will have 4 years to dedicate their time on a research project. We're going to provide all the knowledge that they need in order to be successful in their research project. They're going to have proper mentorship that is going to help them apply and analyze every single part of their project. We're also, then the next letter is letter C. So that's a clinical sciences, right? Where we're gonna emphasize our curriculum in preventing, diagnosing, and treating diseases, right? We're gonna have a unique opportunity within our medical school. We're gonna have a trailblazing clinic on site. So that will be a very unique opportunity. We're gonna be able to provide with that small clinic ambulatory care training to our students from day one. Then the next letter of our curriculum is the H. So that's health system sciences. So we're gonna have a big emphasis on, sorry for that. So we're gonna have a big emphasis on just when we're talking about health system sciences, we're going to make emphasis in robust social determinants of health and proper integration with other professions. Then the next one is embracing whole health, and we mentioned whole health, and I think that this is, again, very unique, where we're going to see our students, our faculty, our staff, and our future patients, we're going to provide that whole health approach, right? Where self-care will be emphasized prioritized for every single individual in our school. And then the next one is the Science of Medicine, the S. And that's one that I'm overseeing, right, where all the different science component and all the different disciplines, anatomy, physiology, microbiology, pathology, pharmacology, just to mention a few, right, will be interwoven and really well integrated with all the different components of our curriculum, and more than anything, they're going to be delivered throughout all the 4 years of our curriculum. So that's a little summary of what our Arches curriculum is.
Great, thank you.
Bravo. I was just looking at the board and thinking that if you guys wanted to get some of that.
Keep this, right? The way our curriculum is designed is that the first 18 months will be, as I mentioned to you, like every single components of the Arches curriculum will be emphasized, and will provide the foundation to go then into years 3 and 4, where our students are gonna spend most of the time during their clerkship rotations, right? And then we're gonna offer in years 4, we're gonna offer electives. So the first 18 months will be heavy on the Science of Medicine, but again, every single week there will be a time and place for all the other components of the curriculum. So research, we're gonna have clinical skills also integrated in our curriculum, so that in the afternoon, what we cover in the morning in terms of science, they get to apply them in the clinical setting, right? We're gonna incorporate health system sciences, we're gonna incorporate, again, all health. So all these different things are gonna be incorporated and heavily emphasized in the first 18 months of the curriculum, and then years 3 and 4 will be more clinical. But again, pretty well integrated with all the other components of the curriculum.
Great job.
I have one more question.
Yes, go ahead.
So, since you've been talking about the overall well-being, do you guys plan on having extracurricular activities for students or any extra things?
Yes, so we're being extremely prescriptive about that. I think that we have designed our building. If you have a chance to see the renderings, we have plenty of healing, like what we call healing spaces. We're gonna have trails. We're gonna have rooms for the students to practice their well-being. So yeah, I think multiple opportunities will be there. We're being very prescriptive to enhance well-being.
Can you talk about the residency matching part of it? Like, is there anything specific that?
Residency.
Yeah.
So I guess we're
Early days.
I like to call it embryonic stages of our curriculum. So what can I say about residency? One thing I guess we can talk about in terms of residency, and I'm pretty sure that you can probably expand on this, that right now we're working with the hospital system here to increase the number of residency spots for future students, so that we provide like unique opportunities for the students to stay in the area if they really like it. I think that that's one of our main priorities, to bring a diverse group of students that stay in the area, right, and help improve the healthcare system that we have in this specific region.
So, sorry, I'm interrupting.
No, go ahead. This is
So the primary care crisis, do you believe that your institute would be able to help with our physicians?
Absolutely. So being part of like the discussions, the whole reason why this medical school was created is because our founder saw a need of improving the primary care, right, field. And with that, we are in conversations to expand different opportunities to work on those specific aspects. As I mentioned to you guys before, we are doubling, I think, and I don't want to be too prescriptive in the numbers. I think that at least I know for sure that we're working on adding 50 spots just for residency programs. So I guess in terms of like different specialties, that's also being is being analyzed. We're partnering with other institutions. I probably cannot give you the names, but we are partnering with other institutions to also kind of like increase the number of subspecialties in the area. There is a big need for that too.
And I can talk more about kind of like this overarching health transformation initiative that
Yes,
you
you.
alluded to.
Mhm.
Yeah,
I don't have too many details. Yeah, you probably Beth have more details.
it's very high level.
I don't know. I guess accreditation. That's something that I don't know. Beth, you want to talk
Sure,
about?
yeah, well,
Let's switch.
okay. So there's essentially three parts, okay. There's essentially three parts when you think about this whole health transformation, and we're really starting and focusing here in Northwest Arkansas first. The idea is to pilot and test and then be able to scale on a larger term, perhaps the rest of the country, certainly the rest of the state. So if you think about it in these circles, a Venn diagram comes to mind. Whole Health Institute was the first thing that Alice Walton founded in 2019. And so they're very much focused, their programs are specific to creating a whole health delivery model and working with partners like Washington Regional to pilot that. So thinking about the entire patient's journey, and this is really, about preventative, not just managing diseases, but thinking about social and emotional and mental and physical health all together. And the second part of their charge is really on the value-based payment side. So if you think about the traditional fee-for-service structure, there's some issues around that, and it impacts the way that physicians and healthcare practitioners are able to treat people. So, creating something that is more incentivizing for healthy outcomes is a huge goal and advocacy effort on the Whole Health Institute side. And then the School of Medicine, of course, we've talked about, really focused on creating this pipeline of new physicians that are trained in these whole health principles and self-care philosophies. That's the second part. The third part is the health systems. This is very much, under development and being shaped as we speak, but the idea here is we know that we need to increase access to residencies, and we need more physicians, but we also need more specialty care. And so working with partners to be able to do that, and eventually creating a new health system that can kind of support and bridge both the Institute and the School of Medicine.
So with Alice Walton Med School, you've talked about all of like the holistic parts of it, but what makes it different from everything else? Is there anything more to that?
Yeah, and I can back up and just tell you what it is. So Alice Walton School of Medicine is a nonprofit. It is, the plan is to provide this program that combines conventional medicine with whole health principles and practices. So a 4-year ND degree granting program. What makes it really unique, I think, comes down to, if you think about traditional medicine, being very focused on managing and preventing disease, and integrating these complementary services or preventative, thinking about training the physicians in self-care practices so that they can not just take care of their patients, but take care of themselves, and empower and be stewards of good health for their patients. So things like health coaching we're talking about, and integrating nutrition, and the curriculum is really meant to be very robust and consider these like social, environmental, and other factors that we know contribute to poor health that we're not talking about as much as we could be. So the other part that's unique that Yerko touched on a little bit is the campus, the unique way that the School of Medicine will be set up on the campus with Crystal Bridges Museum of Art. So there's lots of opportunity for, cross-learning in terms of the museum and arts education and therapies there. But then we have 120 acres of gorgeous Ozark setting, to really to heal and to be in nature and to have that impact on our students is a really exciting and unique element.
I think that's so cool that the intersection between art and medicine, I think, is left out in so many places.
Yes.
And it's just really interesting because that's the first thing that caught my eye when I was researching it, that it's on the grounds and you can just go over to Crystal Bridges whenever.
Yeah,
That's
it's going to be amazing.
Yeah. Okay, so since the med school is so different, is there anything different that you're looking for in applicants specifically?
It's a really good question. We do hope to have a diverse pool of candidates, and high academic achievement is almost a given. Of course, we want the best, the most talented, but we also want to focus on things like medical ethics and community service and making sure that our students are really well-rounded in terms of understanding whole health principles. We also want to make sure geographically we have good representation from Arkansas, the state of Arkansas, where we know there's a lot of underserved communities, and then nationwide. So a lot of factors to consider here, but we certainly are looking for a diverse and talented pool of students.
Yeah. So with the Arkansas, the underserved communities, do you have plans to help encourage people to go pursue more rural medicine because those places don't get any attention much?
Absolutely right. Yes, there are conversations underway with those communities as we speak. So we'll be able to talk more about that very soon.
So with application to it, what's the timeline for the inaugural class and future classes?
Good question. So the goal here is to break ground on construction of the medical school this spring and to have that completed by 2025. Backing up to our accreditation goals, we will need to be able to start recruiting in 2024. That is a rigorous and long process, and actually it won't be complete until the first graduating class finishes in 2029. So that's when we would get our stamp and the EDU behind the domain. So that would be the official, when we are fully accredited both programmatically and on a national scale. But yeah, we anticipate matriculating the first class in 2025.
Okay, that's interesting. So do you know when, would the application timeline just follow normal med school applications for that class?
Oh, yes, so applications will essentially be open the same time they are for others in 2024. I don't actually know. Summer of 2024. So more information will be online on our website very soon.
Okay. So with your partnerships that you were talking about, can you talk about broadly what you're looking for in partners and how those are supposed to help? How are they going to help serve your students?
I'd say on a just very general scale, we are a new institution, so we want to be transparent about what we have and don't have. Partnerships are absolutely critical. A lot of benefit comes with being new. We can lean into innovation and try new things and use all of the latest technology, but we absolutely have to learn from the past and learn from traditional medicine and institutions that have been around for hundreds of years and know what works and what doesn't work. And so we're doing that through, our board of directors has just a pool of talent and expertise in this area, as well as some of the other partnerships that we're looking to set up with other medical schools and health practitioners and beyond.
Oh yeah, I realized we didn't introduce you, so can you give a
Sure, yes.
Just jump right in.
Yes. My name is Beth Bobbit. I'm the Director of Communications here at the School of Medicine.
Is there anything else that you want to talk about with the school, how it interacts with the community in Arkansas, and how that would be of interest to our Arkansas HOSA members and who are about to go into the medical field?
I can say that, as part of our values, we are very community focused. and I should rephrase to say that we are of the community. So we want to continue to build these relationships with our neighbors and our friends, and part of our recruitment strategy is to get roughly 50% of our students from the state of Arkansas. So, you know, again, this health transformation strategy is very much focused in our region. We want to try this out here and see what works and then scale from there. So, yeah, the region and the support from the community, we cannot do this in a vacuum, so it's absolutely critical.
Okay.
Anything else?
Yeah, I was thinking that probably for partnerships, right? That, well, you can say that, I guess. We're trying to kind of like partner and provide more opportunities for like in the research arena, and also like to bring like some specialties that are not, I guess,
Yeah.
well represented here in the region. I think
Yeah.
that those are probably two main things that we're looking in terms of partnerships.
It's really well said. Do you want to say that? Do we need to add that, or do you feel like you have that?
I don't know, maybe we could just, I think we should.
Tack it on.
Yeah.
Which would flow better if you said it or I said it?
I mean, if you feel comfortable saying
Okay.
it, that might just.
So,
But like,
I know, okay.
if you feel like you.
he's probably a little bit more up to date on
Okay.
that, but you know, in terms of partnerships, from a research perspective, we are being very intentional about who we seek to be partners with, and part of that is to just acknowledge, you know, the gaps in specialty care in this region, and really look to some of these institutions that have been around for a long time and are good learning partners. So we'll continue to pursue that and have more on that soon.